As President Trump signed a new executive order today aimed at lowering the cost of prescription drugs in the United States, he singled out weight loss drugs as part of his inspiration.
A friend of mine who's a businessman, very, very, very top guy. Most of you would have heard of him. A highly neurotic, brilliant businessman, seriously overweight, and he takes the fat shot drug. And he called me up, and he said, President, he calls me, he used to call me Donald, now he calls me President. President, could I ask you a question? What? I'm in London, and I just paid for this damn fat drug I take. I said, it's not working. He said, I just paid $88, and in New York I pay $1,300. What the hell is going on?
Quite a story there. As the president said, he now wants the most favored nation rule, where drug makers have to offer U.S. patients the lowest price that a peer country would pay. U.S. prices across all drugs, both brand name and generics, are nearly 3 times as high as those in other countries that you can compare. Adjusted for inflation, the spending on retail drugs per capita in the United States has jumped from an average of $101 in 1960 to over $1,100 in recent years. My source tonight is Dr. Zeke Emanuel, who is a former health policy advisor to President Obama, and it's great to have you here, sir. On just what the president is trying to do here, I think everyone agrees they would like for this to be less expensive when they have to go to the pharmacy, but does the president have the legal authority to lower them this way?
Well, you're asking the wrong guy. I'm not a lawyer, but I don't think he's got the legal authority. And the last time he tried this during his first administration, the courts threw it out because he hadn't gone through the right process. And I doubt that even if he went through a process, that he would have the legal authority to require drug companies to reach the same price or equivalent price as is paid in other countries like Canada or Britain or Germany or France.
So what do you believe it would take to bring down drug prices for Americans?
Well, first of all, the problem of this most favored nation's pricing, so that you ask what Germany or France does, is you basically outsource your pricing to them and you trust them to have made a good deal, which may or may not be true. The second thing is, as we know in America, there's no single price for a drug. Some people pay less, Medicaid gets less, the VA gets less, commercial insurance, those of us who have private insurance pay the most. And same thing in Europe. Governments negotiate with drug companies. They get discounts that are confidential. And so exactly what the price is and what you're comparing to really matters here. And the president's been totally vague about that detail. The last point I would make is drug companies are not stupid. This was announced and all of their stocks went up 5 or 6% today. Why? Because they know that there are ways of getting around this. Let me give you one. They get a new drug approved in the United States, but it hasn't been approved anywhere else, not in Britain, not in France, not in Germany. What's the price you're comparing it to? So they can manipulate how they get drug approvals to ensure that they get good pricing in the United States, because the United States is where they make most of their profits.
President Trump also announced a new executive order today seeking to lower the cost of prescription drugs. A 2022 report by the Department of Health and Human Services showed Americans pay almost 3 times the price for drugs than other comparable countries. Today's order takes aim at other governments' negotiations with pharmaceutical companies, but many conservatives are warning that this executive order goes against the American free market philosophy. Right now, U.S. drug prices are negotiated behind closed doors between drug makers and middlemen working for health insurance companies. Several industry analysts are saying the order that President Trump signed is more bark than bite, and they question what impact it will really have on drug prices. So joining us now to talk about this is the Commissioner of the Food and Drug Administration, the FDA, Dr. Martin Makary. He was at the executive order signing this morning. Thanks so much for being here.
Great to be with you.
So, Commissioner, President Trump says if the plan doesn't lower costs quickly enough, the administration will enact what he calls the most favored nation model, which will be the lowest price available among peer countries. Trump did try this during his first term, and he was blocked by federal courts, and that was just for a small set, a small subset of Medicare drugs. How is this time different, and how is he going to get this through the courts?
Well, good to be with you, Jake. You're right. That was a different version. It was blocked in one court, and the president now is convening all the power of the executive branch, the federal trade representative, the DOJ, to look at unfair practices and collusion among different manufacturers in pricing these drugs. The FDA, we can do things to lower drug prices. And the biggest payer of drugs in the United States is Medicare, and they have rulemaking abilities that they've never really explored before. So he's convening all of these parts of the executive branch to say, we want to achieve this goal. Let's wait a little bit to bring the different pharma companies to the table and see if they can address this problem. Because I've met with them, and they're well aware that they're pricing some of these drugs 5, 10, 12 times higher in the United States than they're priced in London and Germany and France. That doesn't make sense. It doesn't make sense to any voter out there. And so we need more parity. We want a level playing field, not with the price of drugs here and Singapore. We want a parity among wealthy countries like these European countries, the OECD countries.
Okay. How soon might consumers see lower prices?
I think pretty soon. We're going to work with the pharma companies and these middlemen groups to try to do everything possible to lower prices. They see the writing on the wall. They see a tremendous amount of pain out there. You know, I've been a surgeon at Hopkins for most of my career, and people are suffering financial toxicity from bills, from drug prices. It affects access. It affects poor and minority communities the worst. And medical bankruptcy now is the #1 cause of bankruptcy in the United States. We didn't take an oath as physicians to take care of somebody and then ruin their life financially, watching them get destroyed, their life, retirement, future, their savings, their mortgage, all get wiped out by the price of one drug. We've got these GoFundMe campaigns where people are enlisting their communities, their churches and synagogues to raise money for a drug that costs 5, 10 times more than it does in these other countries.
So weeks, months, like when do you think people should expect to see
I think it's going to be soon. At the FDA, we have good relationships with the pharma companies.
Yeah.
We are asking them to come to the table. They know this system is broken. They know it doesn't make sense. They've got kids too that go to the hospital and get these crazy bills. We also have the ability to enable states to get a waiver to import drugs. Well, we don't plan to use that unless we need to, but there are other options, and the FTC and the trade representatives.
So you know that there are conservatives saying this sounds like price controls from the Soviet Union, and then that's criticism from the right, and then from the left, professor of economics and public policy at the University of Michigan, Justin Wolfers, argued on CNN today that this policy means the U.S. drug prices will be set overseas. He used Sierra Leone as an example. I understand that you're pushing back on that, but take a listen to what he has to say, his larger argument.
We are effectively outsourcing our pricing of drugs to Sierra Leone. Do you think that Sierra Leone is setting its drug prices in such a way as to maximize the sorts of R&D and development and drug development that we Americans want? My fear is that we're not, in which case this could end up hurting the health of all of us.
So I understand. You've already said it's not Sierra Leone. But let's say Germany. His argument is Germany going to take in effect what these pharmaceutical companies need to do the research and development? This is the argument that pharmaceutical companies make. What's your response?
Yeah, so good question. These are not price controls because the government is not setting prices. Instead, the government, as the largest purchaser financially of these drugs, is saying, if you're selling these drugs at different prices in wealthy countries, in the OECD countries, we want the same good price that you're listing in other countries. So it is part of the negotiation of getting a good price. And I think anyone looks at this and says, if we could be honest, Americans are just getting ripped off because these companies can, and no one has stood up against it. The same with the NATO fees or the WHO membership fees. This president has felt that Americans have been getting ripped off, that other countries, wealthy countries, have not been paying their fair share. And so drug pricing is a logical next step in that sort of understanding.